California is all she wants to talk about is the water. They are so excited about this about the Imperial Valley.
Are you ready? You want to start on time? Yep. All right, let's begin. However you feel about the president's plan, don't you think it's good that we at least live in a congressional district where we actually do have town hall meetings on I am very pleased to be here between my congressional duties and my Senate campaign. I think this is the 15th town hall or teletown hall meeting that I've done this year. And we're talking about topic A for the United States Congress, and that is the pending health care bills. We may see a health care bill on the Senate and House floor this month, making some of the biggest changes in our family's health care that we've seen since Medicare was first created in the 1960s. I want to make sure that you have as much information as you can, especially about the new bill by Senator Baucus coming out of the Senate Finance Committee, but most importantly to hear from you. What I'd like to do is go through a brief presentation to focus our attention on some of the issues. Have a presentation from Dr. David DeBoer, a cardiothoracic and vascular surgeon. Also, if Jay Alexander comes, we do have one elected official. Can we get a round of applause for our village president from Northbrook, Sandy Crum? Sandy, thank you for allowing us on your territory. Let's go to the presentation first to focus on some of the key issues. I believe that we should not have the quick answer on health care. We should have the right answer. The problem of unintended consequences and the damage that we could do to family health care could be tremendous. What we have done is put together a plan, next one, that is a centrist approach to health care. If you were at our previous town hall meeting, you heard about this. This was put together by the Republican Moderate Tuesday group, which is 34 members of Congress, because we think we really ought to have some reforms. We think we can lower the cost and expand coverage, but more from a centrist viewpoint. If you go to the next one, our first item is the Medical Rights Act that says Congress should make no law interfering with the decisions that you've made as a doctor. And I think that is a critical principle. It is also mentioned in the President's speech about every time that he speaks on this subject, but it is not reflected in either House or Senate bill moving. We've written it into legislation, and we think it should be part of the final package. The second pillar, by the way, there are three main pillars of our reform effort, are reforms to reduce costs. And you cannot do health care reform in America without lawsuit reform in the courts of America. I want to read you a couple of statistics, or actually let me just go through this real quick. The other thing we want to do is have fully electronic medical records deployed, which at the Veterans Administration it would show to dramatically lower medical errors. But I want to make one change that I hope you agree with. I think that every medical record in the United States with your data should be owned by you. Yeah. And there is a case, and the President makes this, of Medicare and Medicaid fraud, waste, and abuse. In fact, the Congressional Budget Office mentions the Medicaid program as a high-risk program that's subject to a lot of fraud and abuse. Those are their words from the CBO. The final pillar of our reform effort is to lower insurance costs. And I think as an American, you should be allowed to buy insurance from any state in the union. With competition, we would lower costs. Also, the Congress should give individuals the same deduction that employers get. If you have So that's what we stand for, and we think that these will have a very practical effect of lowering costs and expanding coverage. Of course, remembering common sense, the lower you can get insurance costs, the more you'll expand coverage. And so that should be a key part of our reforms. Now, when we look at medical liability reform, I think that's necessary in the United States. You see here, 1 out of 7 obstetricians will no longer deliver a baby. 49% of American counties have no OBGYN. 75% of neurosurgeons will not operate on a child. And we have 48% of medical students now picking their specialty based on liability concerns. Let's go to the next one. Obviously, defensive medicine is the American way of medicine in the United States to avoid a lawsuit. And CBO and AMA estimate that the savings would be substantial if we did have lawsuit reform in America. Go to the next one. This is now the Senate Finance Bill. This is what it looks like. Actually, you can get a copy of this. This is actually fairly straightforward. If you spend time going through, I spent time to see whether it was overly pushed to one side or the other. If you spend time with it, you can actually go through what your individual path is to see how you would navigate what in the House is a 1,000-page piece of legislation. In the Senate, they're marking up right now. This means they're drafting a bill not off of a bill, but simply off the draft outline. So we haven't seen much of the legislation from the Senate side or not. But we understand these are the institutions in the past that patients would have to navigate. By the way, the patient, laser here, the patient starts up here, and then the care is down here. And this is the path that you have to go through. Next one. Right now, the Senate bill, by one estimate, is about $1.67 trillion in cost. It has new taxes and fees of about $838 billion. That's the 838 is basically divided between a dramatic cut for Medicare and then new taxes that are put on the United States. Next one. We also have a number of penalties. Lost WLS Fox here. We have a number of penalties here. Chairman Baucus just lowered the penalty. It used to be about $4,000 down to $1,900 if you're not doing the government plan. The biggest tax increase is on employer-provided coverage, which the government doesn't approve. They're defining coverage, and by the way, this would be coverage that's heavily available in the 10th Congressional District, which they call Cadillac plans. And a lot of you have this Cadillac coverage. This would now be taxed with a new $215 billion tax. Next one. They say that you should be able to keep your coverage. One of the problems is this plan would wipe out Medicare Advantage, which covers about 200,000 people in the state of Illinois. About 3 million Americans have Medicare Advantage, so they would be forced to lose their coverage. We looked at some amendments to ensure that that did not happen, but those were rejected on party line votes in the Senate committee. Next one. Also, we want to make sure that we're not doing WLS again. We need a more stable platform here. Take it down. There are a substantial number of cuts, and I just, as part of my morning preparation, I finally reviewed the CBO score of the Senate bill. The bill cuts $500 billion out of Medicare, and while it was not in the Baucus press release, in the CBO score, this bill cuts Medicare improvement, home health, hospital dish payments, wipes out Advantage, cuts Medicare Part D, cuts nursing, cuts hospital improvements, cuts psychiatric care, cuts outpatient care, cuts durable medical equipment. If you go on the CBO website, you can see the spreadsheet of all the cuts made for Medicare in this legislation. Next one.